Good morning. My name is Jenny, and I am out of birth control and wanted to renew my prescription. I have been out for a while, but like the COVID-19 pandemic kind of scared me from going any near hospital or clinic. Could you help me?
Yeah, good morning, Jenny. My name is Natalie from Asian Health Services, and I can definitely help you. Before we get those services to you, I was hoping we could speak for a moment. I have some questions, and your answer will help me to get the right services to you. I promise it won't take long. The question will help me understand some of your health history. Would that be okay?
Mm-hmm.
Great. Okay, then let's get started. First of all, are you comfortable? Is there anyone in the room with you? I ask because I want you to feel safe and I want to ensure that your confidentiality is protected.
Yes, I am comfortable. Thank you for asking. For now, I'm alone.
So, first question for you is when was the last time you had your period?
I would say about 20 days ago.
When was the last time you had sexual activity?
Well, last week I was raped by my best friend's boyfriend. I work as a housekeeper at this hotel, and I have an inn with like the administrative staff. So I was able to get my friend a really good rate for the hotel room for a relaxing like tele-hotel kickback, a stay caution if my friends use the room during my work shift, right? And then this is like when I was like 8 years old, but like my uncle raped me and I never told anyone.
This is not your fault. Are you feeling pain or having any discharges? Did you report the rape and get a sexual assault exam at the hospital?
No, I didn't go to the hospital. I did tell my best friend though. The rape happened when I went into the room to check out everything and say hello, right? And she hadn't arrived yet, and her boyfriend was the only one in the room. He grabbed me and pinned me down, and that's when it happened. Afterwards, I ran out of the room, and my best friend didn't. She didn't believe me and sided with her boyfriend, and that really hurt. What's even worse is that I actually lost my job, and now I'm unemployed because of the whole incident.
It's horrible to not be believed and to be violated. I'm sorry. Why did you lose your job? Please continue if you can, or do you need a break? Um, it must be hard telling your story. We can go at your pace.
Yeah, so my friends had partied and trashed the hotel room, and because of the noise, the manager called the police and had everyone arrested. In fact, the manager implied me in the incident, and now I have a caution and criminal record, although I didn't do anything wrong. I wanted to go to a hospital or a clinic, but when I told others in my close circle, they said since it happened a week ago, I didn't have any proof. Um, I don't think that I'm pregnant though. I don't eat a lot to make my food stretch between pay periods. So basically, I don't always get my period. It's like really light. It's been irregular for many years too. I guess I'm willing to talk to you because about this so easily because honestly, I have begun thinking about hurting myself, just like really ending it all. Like, I'm just so ashamed and lonely. Like, this keeps happening to me. Like, why? Why? So I guess something's just wrong with me and I'm just stuck.
You are so brave, and I wanted to let you know that you did nothing wrong, and it's not right what's happened to you. You're not alone. So this clinic and our staff are with you. So with your permission, I would like to share with the doctor and clinic manager details about your case to keep you from repeating yourself. I promise that everyone on this team is sensitive and we care about you. We're on your side. Will that be okay?
Yeah.
Okay, sounds good. We'll do that.
Hi, Jenny. I'm Dr. Chang. How are you today?
I'm good. You?
I'm good. Thanks for speaking with Natalie earlier. So I understand that you've been through a lot, and we're going to kind of work to address your medical needs or whatever it is that you need. I hope that you can trust us, and we're never going to do anything without your permission and full knowledge. Does this sound okay to you?
Thank you.
Okay. So I'm thinking that, I'd like you to come into the clinic so that we could do a full exam and we can meet in person. Are you able to do that? I mean, right now we're meeting on Zoom or on the phone. So would you be able to come tomorrow?
It depends on when you schedule because I'm trying to look for jobs, because this COVID thing is making it a bit hard for me.
Yeah, that makes total sense. Well, we'll try to make the appointment. We'll make the appointment work for you. What do you think? We'll work with your schedule.
Yeah, thank you. It sounds good. I can visit the clinic anytime
hmm
Tuesday of next week.
Okay, let me check. I think looks like we have an opening at 11 a.m. Could you be here 11 in the morning next week, Tuesday?
Yes, I will be there.
Okay, that sounds great. So before we go any further, I just wanted to ask you, and just be as honest as you can, and what you feel comfortable answering. But I'm here to try to help you. So do you feel like you might hurt yourself after we hang up this call? Are you feeling that that badly today? Are you feeling badly like that today?
No, I don't feel bad right now. I just know myself. I know that right now I don't want to think about it, and that I want to go out and walk with my friend around the lake.
Okay, so as I mean that sounds good. I ask because your emotional health is as important as your physical health, and we do have mental health counselors. We could set you up with someone right now if you needed to talk with somebody with these feelings that you're going through.
Sure.
Okay, that sounds like a good plan. So we're almost finished. I'm going to invite Natalie. She's our advocate. I think you spoke with her earlier. She's going to rejoin the call so that you can get on with your day and maybe talk to you a little bit more, since you want to speak with somebody. And we're going to get a sense of your safety and support. Does that sound like a good plan? And then we'll meet together next week, Tuesday at 11. Okay, sounds good. I'll see you then. Okay, bye. Nice to meet you.
Um, Hi, Jenny. I look forward to seeing you next Tuesday. I want you to know that we're going to make a referral to our integrated behavioral health department, so you can talk to one of our counselors whenever you are ready. In fact, I can set up a consult for 15 minutes today if you have time before you take your walk around the lake. Here's my contact information, and also you can contact me through my organization Instagram and my work cell phone number. If you have Now you have two ways of reaching me. So if you give me your contact information, I will call you later today for a check-in. Is that okay?
Um, yeah, like wow, you're all being really nice to me. I have 15 minutes today to speak with the counselor.
Sounds good. I'm gonna let her join in right now. Right? Thank you.
Hi, Jenny. I'm Juliet, one of the counselors here at the clinic. How are you?
I'm good. You?
Good, good.
So, can we spend a couple of minutes just creating a safety plan for you?
A safety plan?
Yeah, it's steps that you would take in case you're feeling unsafe. I'll keep a copy and then you'll have a copy as well. Does that sound okay? Okay. Perfect. All right, so I'm going to give you, we'll start with the suicide hotline. And then there's some spaces where we're going to fill out names of people and their phone numbers that you could call when you're feeling really sad. Does that sound like something we can do? Perfect. All right. Let's do that right now. You want to give me a name and I can start filling in for you?
My name or someone to call when I'm feeling
Someone you
sad?
might call when you're feeling sad.
I can give you the name of my friend, Natasha.
Perfect.
Natasha. Do you need her last name as well?
No, as long as you know who she is, that's okay. And then her phone number. We'll put that here next to her name.
Yeah, it's 951-273-844.
Is there anyone else you might feel comfortable calling if you were feeling sad besides Natasha?
Maybe my sister?
Okay. And what's her name?
Kennedy.
Kennedy.
And her phone number?
858-541.
All right. Thank you. So these are, again, these are the people that you are going to give a call to if you're feeling sad. We also have this wonderful program called Survivors Healing Advising, dedicated to empowerment. And they have advocates who are really knowledgeable about folks who are suffering, that patients who have experienced sexual assault, domestic violence, and even commercial exploitation and human trafficking. And they can come meet you at the hospital for support if you were going to need to go into the hospital. If you would like, I can reach out to them and put you on their list so that they would be alert in case you go in. Is that okay?
Yeah, that would be fine.
Okay, great. Yeah, it can be really supportive to have someone in your corner if you have to go into the hospital for, an uncomfortable examination, or you're being asked a lot of questions that feel like they're being kind of interrogating. So it can be good to have somebody there with you in your corner. Cool. All right, so I'm also going to give you my contact information. My name is Juliet, and my phone number is 723-456-1345, and I'm going to put it here on your safety contract or your safety plan as well. And you can feel free to give me a call or a text anytime, especially if you're on the way to the hospital, so that way I can make certain one of the advocates is there to meet you when you get there. All right? Awesome. So thank you so much for taking time to do this safety plan with me. You are really, really brave. Whenever you're feeling anxious or overwhelmed, just remember to take some deep breaths to help you center yourself. In fact, let's take some together right now. So we're going to breathe in really deep and out. In and out. Last time. In and out. Awesome. So we have some good people here. They're going to take really good care of you. I'm glad that you're coming back you're going to come into the clinic next Tuesday. So take good care of yourself and enjoy your walk today.
Thank you.
You're welcome. Bye-bye.
Bye.